La naturaleza de las cosas, con David Suzuki. Escoliosis, opción de riesgo.
February 19th. The pain and discomfort can be very lonely. I think my family gets tired of hearing how sore I am all the time. And you get tired of feeling that way. Lonelier than that is making this decision to have surgery. It's really just my decision, and it's a terribly, terribly lonely feeling.
In scoliosis surgery, we can give a patient the facts, both in having the surgery and not having the surgery, but they have to make the decision. The upside for patients is that they get far more information than they ever had before. The downside is they have to take far more responsibility than they ever had before. If a doctor tells you what the risks and the benefits are, and a doctor tells you how you can be helped or can be hurt, and you make that choice, you're taking responsibility for yourself.
When you look at the spine from the back, it should be straight. A scoliosis means that there is an S-shaped or C-shaped type curve to the back. It also rotates, and so when children come in that have scoliosis, the major complaint of the family is that they have a hump in their back.
La escoliosis fue identificada y considerada una enfermedad hace aproximadamente 1900 años. Sin embargo, hasta la fecha no se conoce método preventivo alguno. Es una afección progresiva. No desaparece en la edad adulta. Si los casos severos no se tratan, puede causar parálisis, problemas cardíacos, respiratorios e incluso la muerte.
When Caitlin was 12, I saw that one of her shoulder blades was higher, more prominent than the other. One of her shoulders was higher and her waistline was uneven. I had her bend over and she had a rib hump and I was stunned. I couldn't believe it.
It was really hard to deal with because I couldn't see it. I couldn't see my scoliosis. I couldn't see how crooked my back was, what it looked like. So I didn't know.
Part of the problem of having scoliosis is otherwise the kids are perfectly normal. But it runs in families, and I think we know scoliosis to some degree occurs in even about 2 to 3 individuals out of 100. There's about 0.1 to 0.2% those people that will come to some attention for treatment, meaning bracing, or for surgery. Unfortunately, if we look at the series of x-rays over the last 8 months, there is a true progression of about 10 degrees, which is what we might expect if a curve is going to get much worse, about 1 degree to 2 degrees a month. The options are not do anything, and there's a role for that. And number 2 would be trying to do everything possible to avoid surgery. And the only thing that's been proven out there to have any impact is bracing.
It'll stop it from getting worse.
Right. But if in the brace you continue to progress, which sometimes happens, that would mean that we would go towards surgery. So you have some options. There are fairly good studies that you can use an underarm brace. However, that brace needs to be worn 20 to 22 hours out of the day. Now the second option, known as a Charleston brace, actually takes this curve and actually the brace almost twists you inordinately into the opposite direction.
We discussed the options of a brace versus not bracing. Caitlin's a competitive swimmer. At that point in her career, she was getting very fast.
I wasn't really sure how I was going to deal with the whole swimming issue. Swimming was my whole life. So the possibility of having to give it all up was really scary. I wasn't sure about what I was going to be allowed to do or if I would be able to swim if I decided I wanted to keep swimming. I was really scared that everything was going to go wrong and I was not going to be able to do anything again.
Scoliosis has a huge impact on an adolescent because of the psychological things they're going through at that time. They want to look alike. They are usually involved in activities that require them to not have to live with the limitations that a brace or surgery is going to impose on them.
Desde los tiempos de la antigua Grecia se intentó inútilmente corregir la escoliosis. En la actualidad existe un sinnúmero de soportes ortopédicos que han probado ser efectivos si esta enfermedad se detecta a tiempo. La mayoría funciona bajo el principio de rotación e inclinación contraria mediante cojinetes de presión o cojines de aire, los cuales ejercen presión sobre las costillas o los músculos de la parte baja de la espalda para hacer rotar la columna y mantenerla en la posición correcta. Los soportes se consideran uno de los 2 tratamientos comprobados para la escoliosis. Si estos fallan, la cirugía constituye el otro método.
I think the most difficult part about scoliosis is the fact that if it runs in a family, it can have a major impact over the course of years, as opposed to maybe more short-lived illness or potentially a death-causing illness.
In the past, I would have considered this ballet class an easy one, but now, as I turned and looked at myself in the mirror, I was greatly disappointed when I realized my leg was still almost touching the floor. I wanted to quit right then. I wanted to run out of the classroom and never come back because I felt I had failed. In a matter of seconds, I had realized that all my hopes and dreams for the future were unrealistic.
Dana Beneman actually came to me at a time when her curve was relatively advanced. She knew that going to a surgical route was going to take her away from ballet. So she pushed the surgical decision aside, as many adolescents would, until it certainly became just so apparent that she really, really needed it. She had a double major curve. She was in a family that was known to have scoliosis, so that there was a known factor in the family.
The worst thing in the world as parents, with Dana, we were taking away ballet, and that's what she'd wanted to be since she was 4 years old. We were taking away her life, and it was a decision that we had made. The surgery is almost always optional, and it's a hard call to make as a parent. You're going to change the way they are for the rest of their lives. There are a lot of emotional things, very traumatic things. In fact, as on top of it as I think we were with our girls, I didn't realize Dana's depth of depression.
My greatest fear of this surgery is, first of all, dying. I don't want to leave so many people that I have here, my family, and then I think about how they would hurt and feel, and it's awful. My second biggest fear is that something horrible will go wrong in the surgery and that I will survive, that I'll actually be more disabled than what I was before I went in. And there's the other fear that if I don't have this surgery, what the future holds for me. And it's pretty frightening to see that I've lost 3/4 of an inch in height, that my spine has digressed by 16 degrees in only 3 years' time. It makes me feel like I'm in a race against time and that I need to stop this before it's too late.
It is a tremendous loss of control of your life. You're literally handing yourself into the hands of someone else, and you hope that you've made the right choice in physicians. You hope that you've made the right choice in having whatever you're having done.
I noticed some changes taking place in my back. I've always been aware of the scoliosis, but in the last few years, I've noticed more significant things happening with my back. It's been difficult for me to walk for any length of time. Correct.
Want to tell me about it?
I always have to be careful not to overdo things because my back will tire easily and it will become very strained.
The x-rays looking at you from the front, this shows your curve, which really runs from just above your waist down through the waist area into the lower part of your back, and it measures about 46 degrees. A moderate amount of curvature, one that we would be concerned about its future. Your head seems to be balanced over your pelvis on that x-ray. And this is an x-ray taken today, but the curve has increased significantly, and that it now measures 60 degrees, which is a lot of change for just a little over 3 years, and forebode for a not a very good future related to what might happen as you age, unless we do something about that.
Not my imagination that it was getting worse.
Certainly not your imagination. I think the most challenging things that I see in spinal surgery are two. One is the ability to relieve pain, and the other is to help restore function. The specialty has evolved incredibly over the 30 years I've been practicing it, and there's always new mountains to climb, which is sort of fun.
I think Dr. Kostwick's reputation nationally and internationally is now firmly established as one of the leading men in spinal surgery for this century. He applied the instrumentation to the front of the spine in a way that had never been done before, and created an area of spine surgery that allows us to do the type of scoliosis and reconstructive surgery we do now. But I believe when he started, his concepts were considered more than cutting edge. He was considered maybe a cowboy. I like to think of him as the grand poobah of spine now.
I hate to paint a dim picture because it really isn't a dim picture, but certainly your long-term outlook is one of slowly progressed problems. Now, that doesn't mean next year, doesn't mean maybe even 5 or 10 years from now, but certainly when you're in your 60s, this could be a really big problem for you. So I do think the only solution is a surgical one.
I'm racing against time, trying to strengthen myself. I should have started this months ago.
To many people, the fear of paralysis is worse than the fear of death. And although the risks are quite low, 1 in 10,000 sounds like a small number. If you win that lottery, it's 100%.
March 11th. The expected, the faith. We never doubt that every day we will have another day, another night, another hour. Megan just expects that I'll be there another time. And it is these isolated moments, these conversations, that become memories more precious than all the gold in the world. During this period when I felt like I was obsessed with death, I walked. There must be a tremendous benefit to exercising and getting away from everything and just being alone and looking up at a sky and all the stars in it and just being in awe of what's out there. Next step is to keep doing what I'm doing and keep pushing myself physically to get ready for this surgery. Maybe eat a little better, quit smoking next week, walking, running, and trying to find those moments of just really appreciating everything I have. I can't believe how fast March is going. Went to Johns Hopkins on Wednesday for my discogram, and all in all, it was pretty intimidating being there. I suddenly feel suffocated by the world of medicine. Must be in good condition for my surgery. Gotta stop smoking in the next 2 weeks.
Good news and bad news. The good news is that we know what we need to do. The bad news is that means we have to fuse you to the tailbone. Okay? The test where we put the needle in your back shows the tailbone here and the disc. There's some dye in it. When we pressurized it, reproduced a lot of your back pain. Well, you're young and you're healthy, so it makes it technically easier to do. If we did it just either from the front of your spine or from the back of your spine, the chances of it not healing are between 20 to 40%, which isn't acceptable. Doing it front and back, the chances of you not healing are reduced to about 3%. And that includes all comers from age 20 up to in their 80s. So you will have, under the same anesthetic, the same day, 2 operations. You'll have an incision along the front of your spine, which runs up from the middle of your tummy up around your tummy button. And then we go behind the contents of the tummy, because they're all involved in a sac and it's easy to move apart. And then we have to fuse this lower part. So what we will do is, through that incision, we will take the disc out here and we will put into its place a combination of some bone from a cadaver and your own bone. The cadaver bone consists of taking a piece from the thigh because that's the right size and can be easily shaped, and it's very strong and heals well. Like a napkin ring, the center will be filled with some of your own bone from your hip.
These were not just words that I was hearing. They were graphic details of what would be done to my body. Although somewhere inside of my head there was a whirlwind of terror, on the outside I remained numb to it all.
And then we'll turn you over, and at the back of your back, shown in this model, we'll make an incision, and then we will fix to your spine at pre-selected areas and place in those screws, and then we'll attach to those screws metal rods, and then to the metal rods we'll attach a special instrument and we will untwist your spine. And we'll take some chips of bone from your pelvis along here, and those will be, the bone will be roughened up, and then those chips will be grafted to the spine, much like if you graft a type of flower or an apple tree, different type of apple tree. Same idea, except it heals in a different way.
I haven't mentioned this to Dr. Kostwick yet, but I'm considering not going through with this surgery at all. It's a hard decision.
For many, many years, up until the late 50s or 1960, patients who had a deformity would be corrected by putting them in a cast, and then cutting the cast and putting turnbuckles on one side and jacking them on one side and tightening them on the other side. Very difficult, very painful, lots of risk. Patients would be in bed a year. The results were generally not anywhere near comparable to today.
A finales de los años 50, Paul Harrington revolucionó el tratamiento quirúrgico para la escoliosis, con el uso combinado de instrumentos y fusión ósea. Así nació la era moderna de la cirugía de la columna. La columna se estiraba durante la operación con barras de acero ajustadas con un trinquete, lo cual permitía una corrección más recta. El sistema de inclinación contraria poseía ganchos en cada extremo, los cuales corregían solamente los extremos movibles de las curvaturas.
When you have a curve and you push on either ends, it's going to do that. Well, we all have a normal arch in our back, and when those rods were put in and you push on either end, people lost the arch in their back. Now, the vast majority of adolescents, or 80% of surgeries done, compensated until they got into midlife. People started to tilt forward, develop what is called the flat back syndrome, no sway, no arch in their low back.
La barra de Harrington debe ser removida en muchos de los primeros pacientes tratados con esta técnica. La columna se separa al frente y atrás para restablecerla y crear el arco natural en la parte baja, y así corregir la alineación del cuerpo. Con la introducción de instrumentos segmentados, la columna se trata como una estructura tridimensional, lo que permite obtener una corrección más natural.
Dear Journal, I think today might be the worst day of my life. I had to go to Dr. Miller again. My scoliosis is getting worse, very fast. I don't want to have surgery, but I want it to get better. I'm so scared. I don't think I've ever been this scared before.
Well, we looked at your x-rays again, and things don't look like the bracing is really working. And that it's going to mean a lot for you, and I know because your swimming is such a big part of your life. And I would hope to get you back, but unfortunately this means that we have a choice allowing you to just get worse with time, like to do surgery. And that's a big step. What are you thinking?
I don't want to have it.
As parents, we are supposed to protect our children. This was a silent thing that happened to her. We were broadsided by it.
I mean, you're talking about being away from your friends in the pool at least 3, if not up to 6 months. So that's why I think you want to think about exactly when maybe you might want this to happen. So I would not expect you to be back up to your full training to really cut you loose for that until almost a year after surgery.
I think this is, pretty overwhelming to hear all this at one time, but did you say if she has the surgery, then what's the chances that she'll need to have another one? I mean, will this likely stop it, or
I wish I could say yes, but we can't say that. And I would expect, unfortunately, that she may come back or may have to have a second surgery. You'll leave me and you'll do fine. But 20, 30 years from now, you may need additional surgery, which I cannot necessarily predict.
how much mobility will she have after this?
If she had expected to be a prima donna ballet dancer, unfortunately, I would say, I think that road is probably going to be closed. But we would expect that she would be able to pursue a fairly normal lifestyle.
Dana went back to ballet on a very limited basis 4 months after her surgery. 11 months after her surgery, Dana danced the Nutcracker. And 18 months after surgery, danced the classical ballet Les Sylphides.
And that was the last one I did. And after that, I don't dance anymore. It's minor changes, like you don't notice, but your balance is different and you don't have the ability to do turns because of the balance. If you can't do an air basket, if you can't bend backwards and that kind of thing. That's what I pretty much realized as soon as I went back, that I wasn't going to be able to be a professional dancer. And Dr. Miller's right, and that was kind of disappointing, but I found something else to gear my career towards, so that's helped a lot. So I don't miss ballet so much anymore.
She's found a career for herself, and her interest in scoliosis, it's become a passion. And I'm hoping that it'll in turn help Madeline, my daughter, and future generations if they do find, in fact, it is a genetic disorder. So I think that's a wonderful thing. It's good that something good could come out of it.
It's terribly frightening to lose control of everything. And I've learned to deal with my pain and my aches, I guess because of my determination, possibly because I still needed to be in charge. Oh, do I ever hate saying that. I will never hear the end of this.
La prueba potencial se realiza antes de la operación con el fin de registrar la respuesta de los nervios ante los estímulos y proporcionar una línea de referencia para utilizarla como punto de comparación durante la cirugía. Durante el estiramiento de la columna, el cirujano puede determinar hasta dónde puede llegar la corrección sin afectar los nervios de la columna.
It's a good feeling to know that you're getting the best of care and the best of technology. I just hope the electricity doesn't go out. I find that my emotions go up and down. There's days and times when I feel I'm okay, this is no problem, I'm going to go through the surgery, everything's going to be fine, and then sometimes at the drop of a hat, I'll just lose control and just cry and cry. I had a day this week that was extremely difficult for me. I was taking my son to camp, and when it was time to say goodbye to him, I fell to pieces. In my mind, I know I'm going to see him again. And then it was everything after that. It was all the fear and anxiety about what's about to happen. If I've been told once, I've been told 100 times at Johns Hopkins, this is a very big operation. And it echoed through my mind that day. It frightened me. I honestly think if I hadn't had that emotional breakdown for one day, for just an hour, I would not be feeling as well as I'm feeling right now. Can I change my mind at this point?
You sure can till the moment you're asleep. No problems
Okay.
about that. Yeah, you certainly can. Okay, I want to go over your surgery. It's a big operation. Now, some of the specific risks. When you cut the skin, there's a risk of infection. At the front part of the spine, that's about 1 in 1,000. The back part of the spine, 2 to 3%. We would also give you blood thinners. The type of surgery we do makes you more susceptible to blood clots. You get a blood clot goes to your lungs, that can be bad news, even in a young person. The risk of transmission of disease from other people's blood is very uncommon nowadays. HIV is about 1 in a million. Hepatitis is a bit more common.
I try to keep in mind that every surgical procedure contains risk and that it is something by law that you must be informed of, no matter how minute those risks are. I'm trying to maintain a positive attitude that they're minimal at best.
It's nice to have a virgin back. I don't see many.
Oh, that hasn't been cut off?
Operated upon before.
Okay.
All right.
Hopefully it'll
See you
only be a
Monday,
one-time
bright
thing.
and early.
Okay. Well rested. Not me, I'm not gonna sleep probably all night. With the surgery being just a few days away, I feel like I've let go of everything. The only way you can reach a point like that is by going through all the other emotions like anger and fear and anxiety and denial. And ultimately, you do get to a point where maybe you're just so tired of having all those emotions and feelings, but you do get to a point where you can just let everything go, and you just know that this is the way it is, and that's okay. June 28th. The weirdest thing about that whole weekend was the eerie calm that finally came over me. I feel like I have a pretty normal life and a pretty boring life, but I've come to the conclusion that I really like my life. I really like my family. I really like my house. I even like my dog again. I like the sky. I like the birds. I like the stars. There's an awful lot of wonderful things here in just my normal, insignificant life. So I'm very grateful at times like this. You look and you're very, very grateful for what you have. From the moment that you arrive at the hospital, your stomach is just tied up in knots. You're weak because you haven't eaten for a couple of days. And it feels as though a volcano is going on inside and it's bursting out. Every step that you take, once you check in at the desk, you know you're getting closer and closer and closer. It was incredibly frightening. They took me away from my family and my friends, and on the stretcher escorted me through all sorts of hallways, and they left me in what they called a holding room. It felt like I was in solitary confinement.
Any type of spinal surgery is high-risk surgery because you operate with large instruments around very delicate structures, the spinal cord, the nerve roots, all of which, if they are touched with an instrument in an inappropriate way, will be permanently damaged. On the other hand, by the very nature of the spine, you have to exert tremendous amounts of force to make corrections, to cut bone out right next to these delicate structures. So it is very intolerant of small errors. bone bleeds quite heavily, and it's very difficult to control that type of bleeding. In the past, the anesthesia techniques, along with the surgical techniques, would not allow us to sustain a person while having this blood loss to accomplish the structural surgery.
Okay, now you can see here that the patient has two curves. This is much less severe looking than on her x-ray because she's asleep and the spine has been cleansed, the muscles taken off, the capsules of the joints taken off, so the spine is quite flexible now, which is good. That means we'll get good correction. Can I have a bone cutter and a bone dish, please? Now what we've done here is expose the joint between the sacrum
What have you got?
and L5, taking off the articular cartilage of the surface of the joint. And now we're going to drill a hole for a screw in the sacrum.
Dr. Kostwick is an incredibly fast surgeon. The combination of both rapid surgical technique accompanied with the very great support of neuroanesthesia allow us to perform these type of major operations on patients at much lower risk, but there are no risk surgeries.
This is a special screw that has a swivel head, so that makes it easier to insert the subsequent rods.
Dr. Kostwick sees the spine in 3 dimensions at all times. He has the ability to look at an X-ray, and both through his intellect and his vast experience to know what that spine is doing in space. And his additional talent is to know how he wishes to make the correction in space.
This rod has been slightly contoured to put into the pelvis.
Segmental spinal instrumentation, or the latest generation of spinal instrumentation, allows us to grab the vertebral bodies themselves through the pedicles with long screws that go from the back of the spine to the front of the spine, allow us to put rotational forces on the spine. They allow us to conform the rods that the instrumentation, the segmental linkages are hooked to the spinal deformities and correct them in situ or in place. If you look at Dr. Kostwick's application, elective surgery of such magnitude for people with scoliosis was beyond what most people were willing to try.
That's it.
Sorry, it's
1, 2, go ahead.
It took an enormous amount of nerve to think that you could go into a body that is twisted due to scoliosis and make it better with this enormous operation and make a person happy because their back hurt or because they did not like the way they looked.
This is a bone screw made of titanium, looks like gold, about the same price. And we're going to put this through the body of L5, in through the graft which we put in, into the tailbone.
His techniques are still as advanced now as they were when he first started.
Oh, come on. Okay, Dan.
When Dr. Miller said surgery and thought of putting my child through that was just, it's like a nightmare. We're being asked to make a decision to accept the risks of surgery and the possible side effects of surgery, to stop her from progressing and to prevent something down the road. Her father and I decided that Caitlin should really be the person to make the decision. She was 12 when she made the decision.
I think my surgery impacted my parents pretty hard, especially my dad. I'd only ever seen him cry a couple times, and he got really emotional. The whole thing upset my mom a lot. She likes to be in control of things, and she couldn't do anything to control it. It was really scary, kind of, because they didn't know what to do. And they're always there to help me, and I didn't know what to do, and they didn't know what to do.
I think the surgery was the right thing to do. The first time, I'm sorry I'm getting emotional, but the first time she got in the water, there were adults that knew her but weren't that close to her that were crying on deck the first time she got in the water and the first time that she competed. It's so hard to see your child go through something like that and not be able to help them. And I really admire her because there's so many adults that wouldn't have had the courage, wouldn't have had the pluck to go back to the sport that they loved and might not ever be able to compete on the level that she was able to compete at before. I admire her every day when she goes to practice, because every day it's hard, every day it's different, and every day she's not as fast as she was and has to work at it. And I find that to be very admirable in a child so young. Sorry. Year and 2 months passed, and I'm still feeling very strongly about it.
I'm really happy I had the surgery. I don't know what my life would be like right now if I didn't.
We're still not sure at what level she's at right now with her swimming, because Caitlin still can't flip, turn, or dive, and especially the shorter events, flip turns and dives make or break the time. And her times were very good. Her coach is very happy with them. He thinks she may be back on to where she was when she left the sport, but we won't know for sure until she can flip, turn, and dive again.
It's kind of discouraging because I still can't do a lot of things, but I have to wait because there's no sense rushing it if it's just going to make it worse.
There was a tremendous amount of relief and exhilaration to be able to look at that date and say, wow, I did make it. It's the same day. I've only been out a few hours. It's very exciting. Even though you're so heavily medicated, that was the thing that I focused on. I remember the sensation of lying on a bed of knives. That was all the staples inside.
Hi, my name's Jennifer. I'm a physical therapist here in the spine service. How you doing?
A little out of it.
A little out of it? And what I'd like to do is try and get you sitting up a little bit, and that may help with some of the stiffness. I know you just had the pretty big surgery yesterday, but we do like to try and get people up day one. What I'm going to have you do is if you can bend your knees up for me. Good. You're already on your side, so you're halfway there already. When you're dealing with spinal patients, it's a lot harder for them to move because any way you're moving is affecting your spine. Okay, I'm going to help you get up onto your elbow. Ready? 1, 2. Okay, good job. Take some deep breaths for me, okay? So what do you think? You want to try for the chair?
You're going to do it, right?
All right. Good. Great. Keep coming. Keep coming.
I remember the first time getting out of bed, how exciting it was that I was able to stand up. I had survived the surgery. Things were going to be okay.
Deep breaths. In through your nose. Keep you out of bed for a little bit. I think that'll be good. Okay. Take care. You're doing wonderful.
The first 2 weeks were very hard. You are very stiff, very uncomfortable, and cannot stay in any one position for any length of time. It generally feels like someone stuck a piece of plywood in my back.
Take some deep breaths. A little modulator. Plus, you've been sitting up a lot today, too. You all right? Welcome to the hallway. With scoliosis patients, you have to relearn where your center of gravity is and where you can move in relation to that. And it is challenging for people.
It's terribly exciting to be so incredibly weak and helpless, and every day you move towards feeling better. It's really a wonderful progression. I look forward to working my way back to independence. I'm determined to be that way again, and I'll deal with the difficulties as they come.
Yeah, we'll have you racing him next week.
That's pretty scary.
I learned to not underestimate myself I've also learned that I'm probably braver than what I thought I was, because I think it takes a lot of courage to face all those fears, and despite the fact that you have them, you go ahead and you go through with it.
Yay!
When you fuse a significant portion of the spine, the levels above fusion masses tend to degenerate at a faster rate. And we're not sure exactly how to solve that problem.
If you have a surgery in the thoracic or chest part of the spine, the odds of you ever requiring anything further in later life are very, very low. Whereas in the lung, if the fusion goes into the lumbar spine, depending how far down it goes, anywhere from 60 to 80% will get into difficulties. Not all of those will require further surgery some 10, 20, 30, 40 years later, but certainly a significant percentage do.
Okay, ready? Uh-huh. All right.
It's hard to not be still. You gotta get up and move around or you just go crazy. I miss my home.
Yeah.
Homesick now.
Surgery will never be prevented until we find maybe what the cause is based on looking at genetics and growth factors.
If we were able to look at a gene or discover a gene or a group of genes, I'm very hopeful that we may be able to, first of all, better understand the biology of the spine and spinal mechanics. The second thing is that with that knowledge, we'll be able to understand how the spine responds specifically to hormonal stress and to our growth spurts. Lastly, we'd be able to use that information to predict in some individuals that yes, we would fuse you at an earlier time frame in which we would be able to fuse a smaller segment. And we would even be able to skip bracing altogether. Perhaps we could use gene therapies that we know that you have a particular gene type that is very responsive to bracing, if we're able to get it early.
I knew Dr. Miller had asked for our family's blood for her study that she was doing, and I had to have a science fair project for my chemistry class. And so I asked her if I could come into her lab and see what they were doing, and she said that was fine.
Dana worked right side by side with me in the laboratory. She did everything from helping me isolate the DNA from blood samples to actually running the PCR, running the gels, developing her own films. Really, all the work she did for her science fair, she did it on her own after she was able to learn all the techniques.
She's an extremely good student, extremely bright, and surgery did change the course of her life. She turned a bad situation around to work for her, and that's the credit to her parents and herself.
If I hadn't had scoliosis, I would have never thought to go into science. I probably would still be planning on being a ballerina for the rest of my life.
July 28th. It has been 4 weeks and 1 day since my surgery, and I am just beginning to feel like my old self again. I'm literally pain-free. I feel great about myself. So the difference that that's made in my life has really quite tremendous. I think that chronic pain probably affects us a lot more emotionally than what we may realize. It probably gives us an overall tired sensation all the time. And certainly that's got to affect the people that you're living with on a regular basis.
Really good throw in there.
Thanks.
You're a pro.
5 weeks after surgery, a little frustrated, feeling like I should be able to do more. I think that there's a payoff for having the surgery, and I am much more restricted in my activities than what I was before. Bending down and picking things up is frustrating. I can't just bend over and put on socks or paint my toenails. It's a very simple thing that everybody does every day of your life, and in the whole scheme of things, if that's all I ever have to deal with, I can deal with it. But there are mornings that it is most frustrating. August 28th. It's only been 8 weeks since my surgery. There are times and moments when I still feel awkward walking. I feel as though I haven't quite got it down, and I must look a little like Frankenstein. There's this little part in me that feels like I'm not human anymore. Between the fillings in my teeth and all this steel in my back, I feel tight, tense, rigid, and totally inflexible at times. When I sit in a chair, I must sit straight up. I look as though I am never able to relax. In a sense, I feel like a stranger, although I know I'm still the same me. I'm finally at the point where I can honestly say that it was very much worth having the surgery. I was worried because while I was recuperating, there were days when I didn't feel so good, and I was really afraid that I would not be able to say that I'm glad I had this surgery. I don't have that concern anymore of how my scoliosis is going to affect me in later years. It's over with, and I feel good.
35 degrees.
Wow. So it was 60-something, right?
Yeah.
Oh, cool.
You've really done well. I'm really, really happy.
You know what I've never seen before? The arch in my back.
Right.
I've never had that.
No, you didn't have that before. That's right.
I'm gonna have to go home and look in the mirror. See what it really looks like on the outside. September 30th. I'm beginning to have a sense of completion. My surgery gets further and further behind me. It is over with. And while I will always have the scars to remind me, I have great relief from the pain and achiness I used to experience every day. That's good too. More and more I'm becoming accustomed to my new body and getting comfortable with it. I'd like to think that I will always have some quiet times in my life where I just reflect on anyone, whether it is looking at a sunrise or a starry sky, or looking at one of my loved ones and just stopping for a moment to realize why I love them. I think it's so important to take time to do those things, and so far I've been able to do that for a few years. So I hope that I'll always have that attitude that you have to just pause every now and then and be grateful.